Functional Neurological Disorder or FND is a trouble with the functioning of the nervous system and how the brain and body send and receive signals. FND inhabits a gray area between psychiatry and neurology. They are deemed to be multi-factorial, which means that numerous risk factors can contribute to the development of this disorder. But why does FND happen? Psychological experiences affect the body all the time. For example, when there is a sudden shock, heart beats faster. In case of embarrassment, the face goes red. When someone is upset, the eyes produce tears. Some typical changes can happen to the body without a medical reason or disease. They are not always within our control and can happen automatically. FND also occurs through the mind-body link. What makes the mind-body link cause FND? One aspect to insight FND is to think of a pressure cooker. When heat is turned up, under a pressure cooker, steam builds up inside it. It has a valve to release excess steam, but sometimes this valve can be blocked. In the same way, difficult life events and ongoing stresses affect people. Emotional and physical strain builds up inside people, like the steam builds up in a pressure cooker. This can be unexpected, such as sudden bereavement, an abrupt serious illness, or gradual. For example, financial troubles, living with physical health conditions, overworking for prolonged intervals. We all require approaches of releasing pressure or stress, just like a pressure cooker needs a valve to release steam. If we are not able to do so, then stress is released through the mind-body link and FND episodes can occur. Even though FND is listed as a rare disease, scientists are discovering that functional symptoms are often observed in neurological services that make it up a familiar disorder. One report reveals that about 1/3 of outpatient neurology clinic appearances are patients stating functional symptoms. While the accurate frequency is unknown, FND is the second most common cause of a neurological outpatient visit following headache or migraine. The mechanisms which bring about FND persist to be inadequately understood, in spite of its occurrence, within neurological clinics. FND symptoms can include blackouts or fainting, non-epileptic seizures, spasms, tremors or shakes, paralysis, limb weakness, sensory disturbance, vision loss, speech symptoms, etc. FND symptoms are reversible. Symptoms in most patients get better naturally with time, but recovery is typically improved with access to the right backing. Several individuals find that, once they obtain an insight of FND and how to cope with the symptoms, they stop happening as often. Even though, in the past FND has failed to gain the interest of researchers and clinicians, the predominance and prospective reversibility of functional illness have topped modern research interests. Latest scientific outcomes are shaping how patients are diagnosed, treated, and creating an inclusive shift in mindset toward functional neurological disorder patients.